When the public health system needed to spring into action, when the pandemic hit, the public health system did spring into action. And we saw individuals who were working way beyond their capacity for months and months, and in some cases years, without a break.
When you think of public health, the COVID-19 response is front and center for many of us right now. Physically and emotionally exhausted staff at hospitals, clinics, and medical offices spread across the country. Thousands of medical professionals injecting vaccines into millions of Americans' arms. All of this work protecting us from the pandemic has left many public health professionals burnt out, with many of them leaving the field or retiring. We owe them some relief and a plan to reinvigorate the public health workforce. Enter AmeriCorps, an agency formed in 1993 under the Clinton administration to provide Americans the opportunity to participate in national service.
66% of AmeriCorps volunteers, say it, 66% chose public service as a career. And virtually 3/4 of them continue to be regular weekly volunteers. Till my last day on earth, I will be grateful that I had a chance to start AmeriCorps.
Moving ahead to 2021, AmeriCorps and the Centers for Disease Control and Prevention launched a new partnership to form Public Health AmeriCorps, which leverages the AmeriCorps National Service Model to allow Americans to work in public health. Now, a little over a year into its stand-up, Public Health AmeriCorps has recruited over 1,200 people who are doing amazing work across many areas of our public health system. This week is National Public Health Week, so it's a perfect opportunity to learn more about the state of our public health system and how AmeriCorps is encouraging Americans, especially young people, to pursue career pathways in public health. This is Empathy Effect, the Forest Marsh Media podcast that explores the human side of government. I'm your host, Melissa Harris, and today we have Public Health AmeriCorps Director AJ Pearlman with us to break down the needs of our public health workforce and learn how Public Health AmeriCorps is doing its part to meet them. AJ, it's so wonderful to have you on Empathy Effect. I'm super excited to talk about you and to share some of your journey and work with our listeners. So it's great to have you here today.
Thanks so much for having me. I really appreciate it.
So first of all, I just want to share with our listeners some of the impressive work you've done throughout your career. You've been involved in childhood mental health research, LGBTQIA+ advocacy and policy research, even campaign work. And now in more recent years, public health planning and response. Some of the common through lines, though, have been the core of service and promoting equity. So what initiated your interest in public service, and how has the lens of reducing disparities informed your work?
Thanks so much, Melissa. I would say for me, one of the key things that has been important to me has been understanding early intervention and what it means to get involved in children and youth's lives early on. I've always been interested in doing what I can to ensure that our communities are safe and healthy and thriving. And the reason that I've been so focused on children and youth is because the earlier in life that we can provide support, empower folks to be their best, and really help break down any barriers for them, the more they can go on to support their communities as adults. So for me, working in communities that face additional challenges has allowed me just to increase the amount of impact that I can have. We talk about disparities and we talk about equity, and we're making good progress, but there is so much more work to do. And if we want to improve the health of all of our communities, then equity absolutely needs to be at the forefront. So getting involved in public service for me was about having an impact and about being able to reach as many people as possible. And equity has been a through line for me, and definitely something that we all need to continue moving forward.
I definitely agree. And disparities have been front and center with a lot of our public health discourse recently. I know that when we talk a lot about public health these days, COVID-19 is top of mind since it was the front and center pandemic in recent years. But public health is in so many areas of work too, beyond COVID, substance use and mental health, policy, all sorts of things. So I know we're going to talk about Public Health AmeriCorps, but I guess a great place to start here is to chat about what public health exactly is. What is it in your eyes?
Public health is really about people and about systems. On the one hand, we need to be taking care of our families. We need to be taking care of our friends and our neighbors. And so it really is about people. On the other hand, and they work very closely together. We need to be building systems that can support the health of all people. So people should have access to care when they need it. And that means access to healthcare, access to safety. And so it comes down to people and systems. Let me give you a couple of examples. The first, of course, is the pandemic, front of mind for everyone. On the people side, responding to the pandemic was really about mitigating the spread of the infection from person to person. And when someone was infected, making sure that they got the care that they need and that they were able to recover appropriately. And not just their physical health, but I would say their mental health as well. We can't underestimate the toll the pandemic has taken on all of us, whether that's the trauma of losing family members, friends, or community members, that can persist for a really long time. We also had dramatic shifts in our daily lives, whether it was lockdown, schools closing. We had essential workers who were showing up on an ongoing basis for all of us. So all of that has really taken a toll. That's on the people side. On the systems side, we have state and local agencies that were working together to coordinate testing. They were sharing data. They were making protective equipment available to all of us, giving us access to tests. So all of these systems were working together as part of the public health ecosystem, really to protect all of us as individuals. So the pandemic is one area. The other area where this shows up is as we think about survivors of domestic violence or other forms of abuse. For individuals, it's about ensuring that survivors get the care that they need, both in the immediate and long term. But from the systems perspective, a lot needs to happen working together. We have local domestic violence response organizations. We have healthcare centers who are providing care. Sometimes we even have law enforcement and other local safety organizations engaged. So, people and systems is really what it comes down to.
Yeah, and I love how you give the example, not just the pandemic, but these other areas of work where public health is, really critical. I think it really goes to show how intertwined it is and how many diverse roles there are in making a public health system work. And as you definitely know and touched upon, COVID has taken a really big toll on all of us, especially the public health workforce. And I know what you're doing with Public Health AmeriCorps is touching on rebuilding the public health workforce. But, before we dive into that, I really want to chat about your previous position, which was HHS's COVID-19 response chief of staff. So at that time, when you were in that position, what were some of the biggest impacts of the pandemic on the public health workforce?
So, first, let me just say that the public health workforce shortage has been something that really has predated the pandemic. And what COVID did was it really pulled back the curtain for us. But I would say a couple of things. First of all, the shortage that predated the pandemic is really tied to limited resources and declining budgets for public health over the past several years. But on top of that, when the public health system needed to spring into action when the pandemic hit, the public health system did spring into action. And we saw individuals who were working way beyond their capacity for months and months, and in some cases, years without a break. So burnout was a huge issue in the public health workforce. I think it continues to be. We also saw politicization of COVID and the COVID response in ways that I don't think the public health system had quite experienced before. So we were hearing about harassment of public health officials and honestly safety concerns for public health officials and their families that led some individuals to retire early or to leave the workforce to protect themselves. So the workforce challenges that we face and have faced were exacerbated. This is one of the reasons I'm excited about Public Health AmeriCorps. I know we'll get to talking about that in a bit, but we are hoping to bring a new generation of folks to the public health field to help address some of these challenges.
I'm wondering, you're so passionate about ushering in this new future of public health. What kinds of stories have you heard across the field, either for folks who are in public health now or are interested in public health?
Yeah, we have, I think, two big challenges right now that are facing the public health workforce. The first is definitely this understaffing issue. The second is along the lines of fair pay. So, just on the first issue, a recent study by the De Beaumont Foundation and the Association of State and Territorial Health Officials found that state and local health departments would need somewhere around 80,000 more people to be able to adequately provide core public health services. So,
Wow.
we are vastly understaffed across the country. And second, I think I would say the public health departments have been inundated by resources as a result of the pandemic. And while desperately needed, hiring processes and salaries have really not kept pace with the urgency with which we need people to join state and local public health. So we frequently hear that people are receiving job offers from the private sector or from healthcare or other employers before they're even hearing from public health departments where they may have applied. So we're losing highly qualified candidates who might otherwise be perfect for the public health field because our systems and processes are outdated. And one of the things that we are working to do through Public Health AmeriCorps is make more connections between our members and state and local public health to be able to provide those pathways directly into governmental public health.
Yeah, and I think this is a great moment to really dive into AmeriCorps as a whole and what you're doing there. Can you provide some context around Public Health AmeriCorps in the greater AmeriCorps mission? I know it's one of the newer branches of AmeriCorps, but for folks who aren't aware of it, what is it in a nutshell and what are you aiming to do?
So, AmeriCorps, which is the federal agency for national service and volunteerism, has a long history of collaboration. So, working with state and local governments, partnering with other federal agencies, and building relationships with community organizations. AmeriCorps also has a long history of directly supporting members who are serving in public health roles. So we've had AmeriCorps members who have served as recovery coaches to help individuals overcome opioid addiction. We've also supported longstanding programs like the National Health Corps. When the pandemic hit, AmeriCorps members were there. They were distributing food to community members. They were providing assistance at testing sites. And AmeriCorps was really uniquely positioned to bolster those community response efforts. And that continues today. So, coming out of the work that AmeriCorps did when the pandemic hit and the budding partnership with CDC, AmeriCorps and CDC launched Public Health AmeriCorps, which is a new initiative to recruit, train, and develop the next generation of public health leaders who will be ready to respond to the nation's public health needs. Our goals are twofold. One is to address the public health needs of local communities, sort of those immediate needs that are happening today. And the second is really to provide a pathway to public health careers for those members who choose to serve with Public Health AmeriCorps.
Yeah. And, just in this past year or so, Public Health AmeriCorps has gotten itself involved in 82 different programs across the country to support pandemic recovery and public health needs, which is impressive considering, how new a lot of this is. So I'd love to hear if you can share some examples of the work that you're doing across these programs and what it looks like in our communities.
Absolutely. As of February of this year, we had more than 1,200 Public Health AmeriCorps members serving across the country. They're providing capacity and support in local public health settings and advancing more equitable health outcomes for both historically and currently underserved communities. We have 82 organizations that have been funded in the first year to support upwards of 3,000 AmeriCorps members. And those organizations are health departments, higher education institutions, national nonprofits, community organizations, and others. And members will be serving in almost every state, as well as in Guam and Puerto Rico. Members are addressing health equity and social determinants of health. Some organizations are still working on COVID recovery, testing, and vaccination outreach. Others are more focused on community health worker support, providing access to services and reducing barriers to care. And a handful of others are also focused on behavioral health, both mental health and substance use disorder. The experiences that members are having and the service that they are providing involves health education and training, outreach and education, and in some cases, research and referrals and linkages to care.
I think it's important to emphasize for a moment that AmeriCorps has lots of positions that are, volunteer, part-time, full-time. A lot of these are shorter term, so 10 to 12 months. It provides a lot of flexibility. How are you navigating with different public health organizations, states, federal agencies, all these partners to take advantage of this flexible programming to get people in these sort of places across our public health system that need help and ultimately, use the AmeriCorps model to also create a gateway for more people, especially young people, into public health as their career pathway?
Absolutely. So, one of the things that we are most excited about for Public Health AmeriCorps is its flexibility. Communities benefit from the flexibility, members benefit, the programs benefit. I would say, I referenced this before, but on the program side, organizations are able to respond to their local community needs, and we have the flexibility to do this with their funding. Having a combination of part-time roles, full-time roles provides significant amount of flexibility for those organizations and members. We know that people today, especially young adults, are looking for hands-on skills training that can open up doors to employment. And that's the piece of the puzzle that we're trying to solve for. So members can serve with Public Health AmeriCorps while they're going to school, while they're working, while they're handling family needs, all while getting that hands-on experience in a public health setting. And that flexibility is really important to people. So AmeriCorps has a long history of interagency partnerships. We are working with a number of external organizations, both in the public health field and in the national service field, to engage and recruit members from a wide variety of backgrounds. And we are hoping that one of the outcomes of Public Health AmeriCorps is that we are able to diversify the future public health workforce. And when we talk about diversity, we talk about age, we talk about background, we also talk about lived experience. And one thing that I think we can say about young people today is everyone has the lived experience of going through the pandemic and understanding and living through the impact of the public health system and what public health does.
I think that it's been really incredible seeing how you're trying to, get people, especially these younger people, into these really critical positions that our country needs. I think back to when I was in college and I was I was pondering whether I wanted to go into medicine or public health. I didn't know where to start. I ended up becoming a writer, and here I am podcasting now, so I didn't quite get there. But what kinds of outreach and messaging are you doing to reach these young people who are so critical to rebuilding our public health workforce?
I wish Public Health AmeriCorps existed when I was in college. I, similar to you, decided to go to law school and took a circuitous path here. So, what I'll say is, I've been so impressed by young people today, by youth who have, like I said, lived through the pandemic and saw, sort of prom was canceled, or they couldn't go to school, or there were a football practice. There were other opportunities that they would have had throughout their time that they weren't able to achieve or that they weren't able to be a part of because of the pandemic. So, what I see today is many people who are channeling that grief and frustration into much needed change. So we're really starting to ramp up our outreach efforts this spring and are excited to get the word out about Public Health AmeriCorps. We're reaching young people by building partnerships with a number of organizations that work with high school students and community college students. We're also talking with key community leaders like college counselors, high school counselors, teachers, and organizations that work with young people in communities. The really cool thing about AmeriCorps is that the only requirement to join is that you have to be 17. So we see this as an opportunity to get hands-on experience and foundational training in a public health setting while getting paid and earning money for college. So it's a really awesome opportunity, and we're excited for more people across the country to know that it's available to them. We're also really lucky to have great partnerships with national public health organizations who are working with us to get the word out to state and local health departments and local public health organizations about the opportunity involved as a host site for Public Health AmeriCorps. The last thing I'll say is AmeriCorps writ large has been growing its recruitment and outreach efforts to ensure that we better reach young people where they are. So we have been building out strategies around digital marketing, leveraging tools like Handshake to reach college students searching for their next steps after graduation. And while Public Health AmeriCorps is still a young program, we're working hard to build out these tools and leverage these resources to really spread the word.
That's really fantastic. And I also think one key way that really inspires young people to get into national service is to hear from people who have chosen this as their career pathway. And, as we chatted about earlier, you've clearly spent a big chunk of your career in public health and in national service. So, can you speak to how this work has impacted you? What value have you felt throughout this work and the journey of your career? And how might it inspire others to follow this path too?
So, first of all, I think engaging in public health is something that we can all feel in our daily lives. For me, I have experienced the public health system throughout my life, whether it is in my role as a parent to two little kids who sort of have spent most of their lives at this point going through a pandemic. My mom is a nurse, and I have watched her and the role that she has played as an essential worker during the pandemic. So public health impacts all of us. Those are some of the ways in which it has impacted me in recent years during the pandemic, but I think that there is a real opportunity to support your community, to give back to your community, and to take care of the people that you love. And that's what drives me. That's why I have engaged in the field of public health. And I think that there is an opportunity for us to address disparities that we have seen within all of our communities and across communities well into the future. This work will never end, but there are ways in which we can move the ball forward. And I'm excited to be a part of it and would love for others to join me in this effort.
Yeah, I love that. It's an evolving journey. It's something that's so essential to our everyday lives. So I appreciate you sharing why it's personal to you. And I can't let you get away today without talking about National Public Health Week, since this is the week it's happening when this episode comes out. It's an opportunity to spread information and take action to improve our community's public health. So, what is Public Health AmeriCorps doing during this week, especially with all this context we've been chatting about supporting the public health workforce?
Well, the biggest thing we're doing is continuing to talk loudly about efforts to get engaged in Public Health AmeriCorps. We are really excited about the work that we are doing to support our members and our grantees. And so during National Public Health Week, we'll be focused on lifting up the opportunities that our members are currently experiencing and the roles that they're currently playing. We'll also be lifting up the opportunities to serve through Public Health AmeriCorps, and we'll be engaging with our national partners. As I mentioned before, we work closely with the American Public Health Association, the Association of State and Territorial Health Officials, the National Association for City and County Health Officials, the National Network of Public Health Institutes, and others to really draw attention to National Public Health Week. And we'll also be pushing the message out through the national service, through our national service networks to ensure that everyone is paying attention to National Public Health Week. It's not just about public health professionals in their space. It's about all of us working together to support our communities. So stay tuned for more. We are going to be sharing more information later this spring about our second cohort of grantees that will allow for an expansion of our program and more opportunities to serve across the country. So, more to come on that front as well.
Yeah, I think it would also be a good moment to chat about how would someone who is interested go on maybe like the AmeriCorps website and get involved. If I were someone who wanted to go and look for opportunities, how would I navigate that process?
Absolutely. There are a couple of different ways. The first is on our Public Health AmeriCorps website, we have all of our participating organizations and their contact information available there. So you can look at the list of organizations, click on your state, and see where there might be opportunities to serve. Almost all of our participating grantees are still recruiting members for this year. And as I said before, there will be opportunities for additional service coming very soon. And so you can click on our website and learn more information there about opportunities to serve. You can also submit an application through the My AmeriCorps portal and find opportunities to serve there as well.
Awesome. I'm sure that'll be super useful for many people out there. And, you mentioned how you were coming out with your second cohort of grantees soon, but I'm curious what else is in store for Public Health AmeriCorps in 2023. You mentioned to me previously that you have about 1,300 people already involved, so there's definitely room to grow. Where are you reflecting on where you are now? What other things are in store?
First of all, we are still recruiting members. We're anxious to get more folks involved. I have also talked a little bit about our connections, new partnerships that we are growing. We are really working every day to strengthen the member experience. We want to ensure that members are getting the training and opportunities and support that they need in terms of exposure to public health. We also are rolling out new opportunities for our members to engage with public health leaders. We just launched our Public Health Leader Speaker Series, and we'll be doing those speaker series engagements throughout the year. I'm really, really excited about that. And it's a great opportunity for members to hear not only about leader career journeys, but also any advice that they may have for individuals who are starting out in a public health career. We're also working across our AmeriCorps programs to build partnerships in other spaces. Just as one example, we're working with our AmeriCorps Seniors program to support workforce development among older adults. And in the coming months, we'll be sharing more information about a demonstration project that's specifically focused on getting older adults ages 55 and up into the public health workforce. So we're looking at this challenge from all different angles, and we'll continue to grow our partnerships with national leaders across both public health and national service to strengthen the connection between Public Health AmeriCorps and our communities.
That's so exciting. You mentioned earlier that one of your goals with Public Health AmeriCorps is to also train and get people into this field. So, what does training look like for people who are involved, especially folks who are muddling over whether this is their career pathway? What tools do you give them so that, they can walk away from their time of service with AmeriCorps feeling prepared for their next step in their career?
The first thing I would say is hands-on experience in a public health setting. That is the number one way that we are excited about getting our members sort of an overview of what it means to work in public health. With regard to training in the more traditional sense, every Public Health AmeriCorps member goes through a 16-hour Foundations of Public Health training course that was built by our colleagues at the CDC. And it covers foundational public health principles, goes over skills like health communications, and highlights important issues along the lines of health equity. So, this is a first step in training around what it means to be a part of the public health field. And in addition, we are building out several opportunities to engage with public health leaders. We're going to have potential opportunities for some of our members to join national public health conferences coming up later this year, and really are just trying to provide as much exposure to the public health field and to the different opportunities that are available to our Public Health AmeriCorps members after their year of service.
I know that one of the challenges you mentioned earlier was that funding, getting people the right salary and benefits to, feel fueled to go into this field of work is a really big obstacle. And, the president's proposed fiscal year 24 budget carves out investments to better support medical and public health workers. So this could be a real great opportunity to fix this issue. What do you make of these investments? And do you think if it comes to fruition, will it be enough to make a difference in rebuilding after the strain that the sector has felt throughout the pandemic?
What I would say is, and let me just focus for a minute on the president's budget for national service, which continues to expand opportunities and reduce barriers for folks who want to engage in national service. And as part of that effort, we know that unique partnerships like Public Health AmeriCorps can help meet the public health needs of local communities, while at the same time providing our AmeriCorps members with the training and resources that they need to pursue their own pathways to public health careers. As for the broader funding to support the fields of healthcare and public health, sustainability is the key to rebuilding. I think we started out this conversation around declining budgets and then an influx of funding when COVID hit. Resources really do need to be sustained over the long term if we are to be successful in recruiting and retaining a public health workforce that can meet communities' needs over the long term.
I mean, I feel like the pandemic hit and we were overwhelmed, and we need to think about how we rebuild in a way where we're not just putting patches on things when, crises hit. So that's a great point. As we're wrapping up here today, what keeps you motivated in your work amid the mountain of stuff we need to get over? Like, just talking with you, I can sense how much energy you have. So, what keeps you going, and what advice do you have for others in the sector who may feel burnt out and need a real morale boost?
So I'm going to wrap up where I started, which is I'm motivated by the young people who are really committed to changing the world and along those lines to improving the health of their communities. And let me just give you a couple examples I met an AmeriCorps member who told me that she's really thrilled to be working on health literacy efforts because she remembers being a little kid and translating for her parents during their visits to the doctor. So her work on translating health resources for community through Public Health AmeriCorps is really exciting to her, and she sees how it could have made a difference for her family if something like that had existed when she was younger. She really does hope to make it easier on other families in the future. I've also spoken to members whose experience through Public Health AmeriCorps has broadened their understanding of public health. It's not just sitting behind a desk every day. There are so many opportunities to serve in the public health field that they're starting to consider careers that they didn't even know about until they joined Public Health AmeriCorps. So I'm really excited about what our young people are already doing and the change that they have already made, in addition to what I know they're going to go on to do in the future. So, for those that are feeling burnt out, I would refer you to the young people. I would also say take a step back and look at the progress we've made. Who would have expected we'd be in a position to end the public health emergency around COVID? We've administered more than 650 million doses of the COVID vaccine. We've ensured that anyone who wants access to the vaccine can get one. And we've learned so much about community needs and public health resources through the pandemic that I am really excited about Public Health AmeriCorps being able to build upon those lessons and empower the next generation of public health leaders to take that step.
Thank you so much. Talking with you has been so incredibly lovely. Happy National Public Health Week. I hope that folks walk away being able to take action and do what they need to do, or maybe even join Public Health AmeriCorps.
Happy National Public Health Week to you as well. Thank you so much for giving me the opportunity to speak with you. And we would be thrilled to have anyone and everyone who is interested in joining Public Health AmeriCorps join us.
I want to reiterate again that Public Health AmeriCorps is still recruiting across the country. There are positions that touch on COVID-19 mitigation, domestic violence response, mental health counseling, recovery support, and more. You just need to be 17 years or older to participate, and there are positions that range from volunteer to paid full-time. You can find links in our episode notes for more information. In the meantime, take some time during this National Public Health Week to show support to our essential workers. We'll be back again next month to hold another health-driven conversation with the Department of Health and Human Services Office of Disease Prevention and Health Promotion. We'll chat about public health objectives the office has set for this decade and how we can measure progress in meeting them. I hope you'll tune in next time. And in the meantime, don't forget to follow, subscribe, and share the show with your friends. Thanks, y'all.
Empathy Effect is a product of Forrest Marsh. You can reach us at forrestmarshmedia@forrestmarsh.com with any feedback, questions, or inquiries.